outside the United States. And you can see here it's largely in Europe, Spain, Germany, Italy, France leading, also the United Kingdom, and then in Asia, China, and Japan. And you can see in particular how China has increased its numbers over the years in particular. Now here's the impact factor. I won't spend time on this, but this is a marker of how often your papers are cited in the subsequent 2 years. This is how journals are ranked, and we have done extremely well, particularly in the last several years. Okay, so when people ask me what can I do to write a great paper, you know, it's interesting. What I tell them to do is read a lot. Because if you read a lot, you'll start to emulate some of the best writing, and you yourself will become a good writer. But one of the ways you learn to write well, beyond reading a lot, is writing a lot. And so that really is the earliest suggestion to you is read top-tier journals, whatever you think the best is in the field for you, and notice how they write and notice how it's constructed and try to emulate that. So that's what I'm going to go to next, and that is constructing the best research. As I mentioned before, if you've got the best research, you're going to get it published in a good journal. And this is pretty simplistic too. You say, well, what are the best approaches or steps then for creating the best paper with the best research? And you have to ask the right question, right? So if you ask the right question, something that's topical, something that's novel, something that's interesting, people are going to want to read it, and journals are going to want to publish it. So you have to distill and make sure you have the right question. Not necessarily always the question that's most interesting to you, but that's most interesting to the scientific or clinical community. And sometimes then it takes refining that question by getting other colleagues or mentors to help you distill and make that question ideal, right? It has to be able to be answered, first of all, and it has to be answered correctly. And so that's what I say there for the second step is once you've defined the question, answer it correctly. And then what this talk is somewhat focused on is being able to effectively communicate your research and its findings. Okay. One of the earliest things you can do is if you have a journal which you are targeting for your research is read through the instruction for the authors. Every journal has these, either in print, online, or in many cases both, and you should just take a few minutes to scan that because if you put it in a format the journal likes to see, that's already a good sign. Whereas if you have the paper formatted or structured in another journal's layout, that's usually noticeable. For example, and without bias, if someone submits a paper to an American English journal, such as JACC, but it's in British English, yeah, it makes us wonder if you submitted it to a British journal, particularly if you're not from the United Kingdom. And the reverse would apply too, as if somebody from the United States or Canada in particular might send a journal to a paper to a British journal, but it's in American English. They might wonder if they're the second or third journal receiving that paper. So take a look at the instructions, learn from those. In JACC Cardiovascular Interventions, we have multiple different categories, and that's something also you should pay attention to. Beyond just original research papers, there's other things such as here state-of-the-art papers or images and interventions, and so several journals have just one focus, but most journals will have different categories to which you can submit a paper beyond just original research. And so look at that. And what I did in particular when becoming the editor is I actually put together editor's pages that described what we wanted to see in a state-of-the-art paper, not just a review of the literature, but it's even beyond a distillation of the current trends, but it's more of an expert, thoughtful approach to the contemporary delivery of care on a particular topic. And so that paper, you could go and find it if you thought about submitting a state-of-the-art work to our journal in particular. So too, we have a section called Images and Intervention, very popular, especially among younger readers of the journal, because they like to see images and like to learn from those in particular. Okay, now more towards the best papers. We talked about asking the right question, and as I mentioned, it should be topical, it should be meaningful, so no surprise to anyone in in the living world right now. Papers on COVID-19 are quite popular. Now, we've only published a few just because so many have been published, but it's clearly a topical subject. I think if you looked at JACC Cardiovascular Interventions over the past year, you would see other topical and meaningful subjects, often having to do with structural heart disease innovations, most recently with tricuspid and mitral valve percutaneous repair options. But obviously you want to start with something that's topical and meaningful as opposed to taking an older topic that, while you may study it well, it's not so relevant to the current literature or practice of medicine. The next thing is, once you decide your question and meaningful subject, you need to figure out the best trial design possible. It may not be a trial, but still you need to think about, if I were going to prospectively answer this question, should I do a trial to try to do that? And if not, then you can figure out other approaches that would be relevant to the subject and category to which you're submitting your paper in the journal. But let's just continue the thought with a prospective trial and think about how to approach it. One thing, or one word rather, that I use is to protocolize. And that means systematically do things, even if it's not a prospective study. If you set out in advance and define what you're going to do, how you're going to do it, what are the statistics that may be involved, what specific tables do you need to populate with data, that will help you to refine, again, the question, the hypothesis, and will help the paper just develop so much better than it would have if you kind of stumble along, so to speak, without a protocol that's telling you what to do. IRBs, or institutional review boards, or ethics committees, will often want to see what your plan is, and that could be also considered a protocol, or protocolizing your thoughts for a group. And so that's another thing I would suggest to do, even if you don't need IRB approval or ethics committee review, is to put something actually formal down about your study. Here's something that seems a little bit unusual to consider, and that's writing the draft version of the paper before the study starts. And you might say, well, what are you talking about? That's bizarre. How can you start writing a paper before the study starts? Well, you actually can, and I'm going to go through that in a few minutes, and that writing of the paper will force you to think more about what you're doing, why you're doing it, how you're doing it, and then how you're going to explain that when formally and finally writing that manuscript. Jumping back now to study designs, I think most people know this, but obviously the weakest evidence, as noted on the left there, is going to be just a single observation of a patient or an event, and that's a case report. And there are some journals that focus solely on case reports, such as JACC case reports, where maybe it's not a single case, but that's what they focus on, is not necessarily prospective randomized data, but cases that are sentinel and educational for the reader. But there's not strong evidence with regard to that single case. But as you go on with consecutive patients in a case series, then into retrospective or cohort studies versus prospective cohort historical controls, you can see that we're now getting not only a larger group, but stronger evidence for the hypothesis we may be considering. This will go all the way forward to a prospective randomized clinical trial, and then obviously if you go beyond a single center, you're going to not only be a multi-center, but then you can go to other countries, other areas of care delivery, and have a multinational randomized clinical trial. And so oftentimes when I first categorize a paper that I'm looking at, I somehow think, where does it fall in the spectrum of evidence? Weak to strong, and that then is going to give me my initial impression beyond the interest of the question, but my initial impression on the strength and desirability of this study and manuscript. Okay, I am pointing out another journal, and I'll give you several tidbits like this where they talk about cardiovascular disease and clinical trials and give some points. I've enjoyed working with a number of these authors and their icons, and I think this is a paper worth looking at if you want to understand strength and design of trials in cardiovascular medicine. In there, they went through some of the things that I just mentioned. They've codified it a bit and put it into this table about some of the key elements of large yet simple trials. And then I and other co-authors have a manuscript coming out in the upcoming weeks ahead. The Journal of the American College of Cardiology, talking about contemporary study designs in stable ischemic heart disease. So be on the lookout for that paper. It follows some of this paper's information, but more specifically focused on ischemic heart disease, my area of interest. Okay, we're moving along. We're almost halfway through, not quite, but about 40% of the way through with my talk, and I'm still going on with designing your study and putting together your manuscript, and we're talking about protocolizing, and here you're clearly articulating your objectives and aims, your hypothesis, your measurements and statistics. And now you can see if you can do that in a protocol, you've already written about 1/3 of your manuscript, and I'm going to come back to that concept in just a minute. You should specify how you will design the study, the variables, the outcomes, etc. Now you may be thinking, oh, this is so obvious. Well, it is to those who are seasoned investigators and seasoned publishers, but I think what I'm trying to do here is give a more broad overview for people starting out in the field that they can apply throughout their entire career. This is a mistake I see often happening, for example, with early and even mid-career investigators, is not involving a statistician early. You should always involve a statistician early, as opposed to once you've collected all your data and you want them to come up with a p-value or a probability value for clinical or statistical relevance. But no, you should do that early on. A statistician is almost always going to be versed in clinical science if they are a biostatistician, and they can help you then to consider, are you thinking appropriately? Do you have your design the best it can be, and are you including enough power in your study to answer the question you're addressing? And so I strongly encourage to involve a statistician early. Okay, I'm passing the halfway point now, and I'm going to start talking specifically about writing the best papers. And as I've already alluded to, you need to adapt this, in my opinion, right as you go approach, and that goes back to the idea of protocolizing. So writing a paper is not something you do when you finish, and then you're getting ready to deliver the information. Again, in my opinion, I think you should start writing it and putting the meat, the basic stuff together even before you've finished. The rationale that you put together for the ethics committee or for the consent form for the patients, if that's the case, or the ethics committee, that's going to be the introduction for your manuscript. It's the rationale for why you're doing this study and some of the background for the reader. That's the introduction. So too, if you've already got an analysis section proposed and the statistician has looked at it and you've said what you're going to be measuring, how you're going to be measuring it, you've basically put together the method section of your manuscript, or you at least have a draft of it. And then, as I mentioned, you can very early on create what are called mock tables. And it may be how many groups you're studying along the horizontal or the top axis of the table. And then along the vertical axis, you may have all the parameters. You know, it could be age, height, weight, blood pressure, things like that. But you're creating those tables and you're already thinking about, what am I measuring? Obviously, what you want is the primary endpoint to be sentinel, probably in your second table, which is going to include your results. So too, if you're going to be presenting your data at a meeting, before it's published, you're likely going to be creating an abstract for submission to that meeting, and that abstract is going to include a discussion and a conclusion, and therefore you virtually finished your manuscript right at the same time you're finishing your abstract for scientific session presentation. With regard to the introduction of the paper, this is where I think some people stumble and they cannot be concise. Why? Is because they have so much information and so much passion and enthusiasm in their head, they try to give it to the reader, and that's an okay thing to want to do. But on the other hand, most readers don't want a long introduction. They want it to be relatively brief, to you to give them enough introduction or background information that they can understand the what is motivating or prompting you, or the rationale for doing the study, and then from there the question. So that's why I say it really should be no more than 3 short paragraphs. Again, in my opinion, it should be the background that they need to know. It should be what is not known or what's missing or what's the key problem with the current knowledge, and then how this study is going to attempt to address that unknown aspect of this area. And again, I think this should be a single page, several paragraphs, and sometimes a half a page is perfect. I would say the same thing about editorials, for example, and I'd like to do a future Bright Talk presentation just on writing a good editorial, because I think a good editorial often has a brief introduction and then goes right to the current paper that it's discussing and helps digest it for the reader, rather than spending a lot of time on an introduction that the main manuscript about which the editorial is being written has already covered. Okay, so that's the introduction. Now moving to the methods, here's where it's crucial to pay attention to details. You must, in your protocol and in your manuscript, define the who, right? When and the where. What population are you studying, from what dates to what dates, and where are they located? So that your reader can know that and make comparison not only to the rest of the literature, but also to their practice or their area of study. You need to define what the outcomes are, what you're looking at. That's obviously going back to your hypothesis, when you're looking at it. And then lastly, how you're going to analyze the outcomes or what you're looking at. And this is absolutely crucial, but now you can think back to how that was probably in your IRB application or your ethics committee submission, or in the consent form that you gave to the patient. You let them know who you were interested in studying, what you were interested in studying in those individuals, and then what you were going to do with the information. So the last thing is, more basic scientists will say that applies to clinical trial science also, is that someone who reads your methods section should be able to repeat your study in their environment, in their laboratory, in their institution or country, and be able to reasonably replicate what you did. Now, they may have different findings, of course, because of the different environment, but they should be able to use your paper as a template for their future work. Okay, here we go now forward with the results section. And what I'm saying here is this really is the most important part of the paper. Now, I know especially younger readers will say, well, the abstract is actually what's most important, and it's the conclusion of the abstract, because honestly, that's what I look at. I hear some readers say, I look at the title and then I look at the conclusion of the abstract. But really, if you wanted to be able to only say one thing about your paper, it should be the results. It shouldn't be the introduction. It shouldn't be the methods even. It really should be your results, because that's why you did this study, and that's why you are publishing this manuscript, is to convey those results to the reader. Obviously, it's in the context of the introduction, methods, and up next, the discussion. But it really is the most important, and I find that some authors won't spend enough time here, and rather they'll present their results in a discussion. And no, the results need to be in the results. You should always use subheadings, too. because the results may include giving details about the population you've studied. It may specifically give dates, times, things like that, that would be helpful to the reader. And then the main results versus sub-results, and I find it very helpful to be in subheadings, and it helps me as a reader or a studier of the paper to digest it or to put it into chunks that I can chew on and understand. But here's what I would say in presenting your results is to spend a major amount of time, and you notice I put it in capital letters, on the tables and figures. And this is what I've said to many people whom I've mentored, is that a single figure can tell the entire story of a paper. And you may have noticed if you read JACC Cardiovascular Intervention and the other JACC journals, one of the main focuses or things we did to improve it more recently was to put central illustrations in. Okay, and here I say never present commentary. That should be in the discussion. With regard to tables and figures, I think you should study key journals, and I didn't put the JACC family in there because it's a given, but you should look at key journals in general medicine also, the New England Journal of Medicine, Lancet, and JAMA. Why? Is because they exquisitely focus on high-quality tables and figures. More so, you should study your target journal, and if it's a JACC journal, you should find a copy online or in print and look at it and see how the tables and figures are put together in that journal and try to emulate those. And that's what I say. Imitation or emulation is the most sincere form of flattery, and it also is going to be looked at by an editor who's used to looking in that format for a table or figure, and I like it. I give you just some short comments about avoiding rookie mistakes, and those are, don't get overly fancy unless it's a journal that focuses on overly fancy. And so I say don't try to convey things in 3D figures. And that's where, again, studying the target journal will help you, but I think 2D figures are easier to look at. Obviously, if it's an imaging journal and it has a lot of online things, and then 3D figures and 3D images may be appropriate and needed. I say do include the number at risk on Kaplan-Meier curves, and if you don't understand that point, you can read about it more, but in brief, a Kaplan-Meier curve is estimating events over time, but as patients have an event, they no longer are at risk for that event, and so the number of patients at risk decreases over time, and also some patients are lost to follow-up, and that's another topic about imputing data. You should define all abbreviations. Some authors sometimes, again, thinking in their head and not in the reader's head, just put out abbreviations that are common for them to use, but maybe not for the reader. And I say do use footnotes aggressively, meaning say things in the footnotes that help the reader to better understand the table and the figures. Here, for example, as I mentioned a moment ago, is a central illustration, and for our journal, these can come hand-drawn, and we employ a professional, or actually several professional graphic artists to make it look very nice for you. But this is a terrific example from a state-of-the-art paper where you can see the author's actually very nice rendition, drawing, but then you can see what the final product looked like. And so this is something attractive in the JACC journals, and you should take a look at those because oftentimes they're terrific and will give you some insight for creating your own figures for manuscripts. Shifting now to the discussion, there should be an opening paragraph, of course, but this is going to very briefly articulate what you found so that if a reader wants to just get that first paragraph and get the main meat, they can do that. It is a way to digest and interpret or restate the results, the main findings of your paper. You're not restating them in burdensome detail with, again, repeating all the hazard ratios or odds ratios and confidence intervals and statistics, but it's more the words as opposed to the numbers in that opening paragraph, what you set out to do and what you did. The middle paragraph may be for the individual or sub-findings that were important to you, and it may also pull in the current literature or the current thinking and how your study fits in for the reader to understand. And then toward the end, sometimes, and I will say oftentimes, there should be a limitation paragraph, or at least sentences. Why is because no paper is perfect, and certainly no study is perfect. Obviously, that's why we use p-values to understand how our observations fit into the truth or fit into all data, if we were able to collect all data that exists for a study, which we can't. And so I think it's perfectly fine to straightforwardly say what the major limitations or weaknesses were and how or why you address them for the reader to have perspective. And then lastly are going to be the clinical implications, or the non-clinical implications they're out there also. So for example, the thing I wrote, or the paper rather I wrote in the last days, it had clinical implications, but it also had financial implications to the current healthcare environment. And so I took some sentences to try to put it in context for the reader about why we should, as a society, afford financially certain genetic tests for specific patient groups, but asking the question is how much will they cost versus the prevention of an untoward event. Okay, ultimately is the conclusions, and this should be very brief, and it should reflect directly upon what your hypothesis or question was. Don't come up with conclusions that have nothing to do with your data, because that's one of the questions we specifically ask reviewers. Are the conclusions appropriate and justified for what the authors intended to do or convey? Sometimes authors will, I don't want to say bend or twist conclusions, that's not quite right, but they'll rather try to focus them slightly in an area that's more favorable or seemingly attractive to the reader, but is not purely on topic or on task with the science or the way the study was designed. So be certain that the conclusions are appropriate. Okay, a couple more comments on the discussion, and then I want to shift the last 5 to 10 minutes of my talk for you. But again, go back and look at the instructions to the authors with regard to the discussion. Make sure that your references are in the right format. Please be sure to use the most up-to-date references. Now, I know some authors will try to use things that they've written themselves, but really try to come up with the ones that are the most appropriate. Some journals are specific, and they'll say, be sure all your citations or references are within the last, and then they may give you 5 years or last 10 years, a timeline where possible. I will say that the more you edit, revise, and circulate to the co-authors of your manuscript, if there are co-authors, the better it will be. I say sometimes it may take 10 revisions to get a manuscript to be as perfect as I think it should be. And I know young authors don't like that, but I say no. You'll learn the more we circulate it, edit it, and revise it, because it'll have more eyes seeing it and more brains thinking about it. So, and it's fine. Just be ready for criticism and more revisions. That's part of this process. Okay. So in summary, with regard to writing the best manuscript, ask the right question, craft a clear, well-planned analysis, write as you go, make sure the tables and figures are ideal because they're key, revise, revise, and revise, embrace criticism, and be strong and sturdy. Don't give up, be tenacious. If the study was worth doing, it was worth publishing. Even if the results were negative, or even if the first journal rejects your paper, if you really thought it was worth doing, it's worth publishing, in my opinion. Okay, there are resources to help you, by the way. If you're an author and you need help, Elsevier's website. I haven't been there recently, but when I put this slide together some months ago for another audience, I found this link, and it's a place for authors to read and get more specific help. And so, too, they have other resources on skills and ideas and things like that. And so I really appreciate Elsevier doing that. And I'd encourage you to go to their website and see what things you can glean from it. The paper's finished, now what? So my last comments are going to be getting the right journal and writing the right cover letter, and then what to do when the paper is ultimately reaches a decision and comes back to you. So again, make sure you've got the right journal. I would say about maybe 5% of all papers we receive probably should have gone to a different journal. Make sure you have the correct formatting for the journal. We talked about that. Select the correct category. We talked about that. And then constructing a cover letter, which there are various opinions about that, and I'll come to those. And so, I used to say how to write a cover letter, but I guess the question might be why write a cover letter. And there are several reasons, in my opinion, but it is controversial, and I pulled this out of an anesthesiology journal, and it says cover letters are a controversial topic. Some journals ignore them, and others pay very close attention to them. But I think there are opportunities. I wouldn't spend a huge or inordinate amount of time writing a cover letter, but some journals require them at the very least because they want to know who's the corresponding author and confirm that, and they want to know these 4 elements that are in the ICJME requirements, and those are that you say the paper's not in consideration elsewhere. They want to be sure you're not sending it to several journals at one time. They want to make sure that the results aren't copyrighted or published elsewhere. They want to make sure that not only you, but your co-authors have not only read the paper, but they approve this version that's being submitted. And they want to know that you've reported any conflicts of interest that are important to be known. Okay. So I think a cover letter is important because it's the first impression, right? That's the first thing that people click on and see. I think it should be nice. I don't think it should be, obviously handwritten and scanned. It probably should be on your letterhead. It should have the proper, style and grammar and things like that. Here's just an example that I used many years ago, but I could almost use this to this day because it's just a matter of pulling in and out the title of the paper and some other things. But I used something largely like that earlier this week when I submitted a manuscript to a journal. It may be the only chance for you to speak candidly about the paper. It may make, or it does provide an opportunity to you make requests, like if you want the editor or the person bringing the manuscript into the journal for consideration. You may say you want certain people to review it or not review it, or you may remind them of an upcoming deadline, or if you're presenting it at a scientific meeting. And there may be certain associate editors to whom you've already spoken about the paper, and you may want to relay that information also. Okay, it's an open platform. You can talk about why you think your paper is important for that journal and for the readers to see at this time. And you can come up with several reasons for why you think it's important for that journal. Okay. Why you want to do it? I think it's required. It's a good first impression. It may be the chance to speak candidly. You can let requests known, and it's also a way for you to state the value of the paper to the readers, which is what the editors are thinking about and to whom we're responsible. So, result of the submission process, what happens? And here's some my off-the-cuff thoughts rounding out my talk, and that's what happens. And I would say if you're told it's a provisional acceptance with minor revisions, the paper is very, very likely to be accepted. And one of the questions that came in earlier is what percentage of all submissions are accepted, and I think overall in the JACC family it's around 10 to 15% of original research papers are accepted. And so you can see here, if you get a revise and reconsider, you're still above a coin flip, so you're at 60% or higher in my opinion. If you get a reject, but it says de novo, meaning if you make a lot of changes, we'll reconsider it from the beginning as new, it's going to have a much lower but higher than overall average. And then lastly, you might get a straight reject. Dr. DeMaria, the last editor, the one before Dr. Fuster, wrote this on Manuscript Revisions. I think it's worth looking at. What he said is of the 40,000 papers he looked at, not one was perfect, and they all needed some form of revision. But you should expect good peer review in this cartoon, which sometimes feels like what you're hearing when you get a de novo reject is somebody just crossing out everything that you've done, and you feel like asking, is this really peer review? I think a de novo reject is what I would call a second chance at bat. It can be confusing because on one hand you're told it's rejected, but on the other hand you're told, hey, consider resubmitting it again if you think you can make a substantial change to the paper. So I'll let you look over that slide and relook at this presentation because I'd like to close in the next few minutes to have some time for questions. What I would say in resubmitting a paper, though, is you should try to resubmit it promptly. If you wait months and months and months, it may be forgotten by the journal. We may think that you're sending it to another journal and that was rejected by them, and so you're coming back to us for that second chance at bat. So I would say try to, within a month or two, resubmit it. Now, if you're asked to make a dramatic number of changes, it may take you a time longer, but I would try to be prompt. I would make your rebuttal comments compelling and pointed, direct, one by one. You should provide additional data as requested and be precise, and you should always be courteous, not only in your rebuttal to the reviewers, but also to the editorial group. I think when you write a rebuttal letter, it should be a separate document. You should literally restate the questions or the points brought out by the reviewer and how you answered it. Now, if you don't agree, you can politely and respectfully disagree in your rebuttal comments, but you need to say why. And that's very important to give the why. So I tried to cover, over the last 40 minutes or so, these high-level things about JACC and JACC Cardiovascular Intervention. I tried to give you some thoughts about what is the best research and how to construct it, and then the idea of protocolizing early on and writing your paper as you go, and then some thoughts about the submission process. I really think this was a terrific opportunity for me, and as I mentioned earlier, I'm hoping that I can do a few more of these on more specific topics, and so would love to have questions or queries now or feedback from the audience about that was nice, but I was hoping to hear about this topic or that topic. And we'd be very pleased, along with the Bright Talk group, Elsevier and the JACC family, to try to come up with a presentation for that topic. So as promised, we have about 15 minutes, and we can take less if there aren't so many questions, and we can try to get through as many as we can. So let me take a look over here at the questions, and there are many, and I'm going to just scroll down through and pick out some, and don't be offended if I don't get yours. It looks like we have 48 questions so far, so I'll try to get to as many as I can, and some are likely duplicates. So let me just scan down through. Okay. When a paper is rejected by JACC, is it best for the author to respond to the reviewer's comments and revise before submitting to another journal in the JACC family? Well, I'll give you a little bit of a secret insight here. So all the JACC family editors-in-chief, so I, for example, am part of not only the JACC family, but I'm an associate editor for the main JACC journal. So I see all the papers that are being considered by main JACC, and I can be involved with the editors' conference calls, and sometimes if I see a paper is not being accepted by JACC, but I think it's appropriate for my journal or another journal, we make that recommendation right then and there. And sometimes in a rejection letter, it might say, you should consider submitting this to, and then they'll list the JACC family journal to submit it to. And I think it's up to you. I think it can go either way. I think JACC is a higher impact factor journal and more globally read, more broadly read. I think that if you can get a paper in JACC, main JACC, I think that's where I would target, whereas if it's I guess more critically reviewed and you don't think you can answer all the comments as easily, and it will have a higher priority in a daughter journal or sister journal such as JACC Cardiovascular Intervention, we'd be happy to see it there. Okay, how long does a review process normally take? Great question. So I can say that if a manuscript does not go to external review, meaning that it's looked at by the editor-in-chief, and I'll say that of the couple thousand papers that come to JACC Cardiovascular Interventions each year. I look at every single one. I personally look at all of them. Well, I'm on vacation 2 weeks of the year.